2 years ago, you had cataract surgery. The vision was perfect. You read menus without glasses for the first time in 20 years. You drove at night without flinching at oncoming headlights. You stopped thinking about your eyes at all. For about 18 months, you forgot the surgery had even happened. And now, somewhere between 16 and 30 months out, everything is getting cloudy again. The headlights have started haloing. Reading the menu is harder than it was 6 months ago. The morning light coming through the window looks softer, foggier than it used to. And your first thought is the thought every cataract patient has at exactly this point. Did the cataract come back? I want to be straight with you. It did not. Anatomically, it cannot. The lens that was clouded was removed during surgery, and a clear plastic lens was placed where it used to be. The cataract is gone, and it is not coming back. But something else has happened. Something that affects roughly 30 to 50% of cataract patients within 5 years of surgery. Something most surgeons do not warn you about before they wheel you out of the operating suite. Something with a name almost no patient knows until they walk back into the consultation room. It is called a posterior capsule, PCO for short. It is sometimes called secondary cataract, though that name is misleading because it is not a cataract at all. And in the next 18 minutes, I am going to walk you through exactly what is happening inside your eye right now. The 5-minute spin-off laser procedure that fixes it permanently. The one situation where your ophthalmologist will tell you to wait before doing the procedure, and the rare risk you should know about, even though it almost never happens. I'm Dr. Richard, your senior vision wellness educator. I have spent years helping seniors understand what is actually happening behind the words their surgeons say, and I want to be clear about why this video exists. Almost no one on the internet explains posterior capsular opacification in plain language to the people who are about to panic about it, so I am going to. If this is your first time on the channel, subscribe. I post a new video every single day on senior vision. Real biology, no miracle cures. And before we go further, type in the comments how long it has been since your cataract surgery. Just the number. 6 months, 2 years, 4 years. I want to see the timing pattern across this audience. Here is what is coming in order. First, the anatomy. What the capsular bag is, where your artificial lens sits inside it. Second, the actual mechanism, why this is happening, why it has nothing to do with the cataract coming back, and why the timeline is usually somewhere between 6 months and 5 years. Third, the 4 things almost every patient assumes are wrong. Fourth, the 5-minute YAG laser procedure, what it feels like, what the day before and the day after look like. Fifth, the one situation where I tell people to wait. Sixth, Margaret composite patient illustrative, and exactly what her timeline looked like. Before I go further, I want to draw a clear line. There are vision symptoms that mean stop watching this and call your ophthalmologist today, not next month. Sudden vision loss in one eye over hours or a single day, that is an emergency. A dark curtain or shadow crossing your vision, especially combined with flashes of light, is an emergency. This one matters more after cataract surgery because the surgery slightly increases the lifetime risk of retinal detachment, and detachment can present this way. Sudden severe eye pain, combined with nausea, that is an emergency. Possibly angle closure, glaucoma. If any of those describe you, stop this video and call your eye doctor today. Posterior capsular opacification does not present that way. PCO is gradual, painless, and bilateral or unilateral in the eye that had surgery. If your vision has slowly become foggy over months, headlights now have halos that they did not have a year ago, and reading is harder than it was when you first recovered from surgery, then stay with me. That is exactly the pattern this video is for. Let me give you the anatomy, because nothing about posterior capsular opacification makes sense without it. Inside your eye, behind your iris, your natural lens used to sit inside a structure called the capsular bag. The bag is a thin, transparent envelope, almost like a soft cellophane wrapper around the lens. Front wall, back wall, 2 flexible halves that zip together at the equator of the lens. During cataract surgery, your surgeon opens the front wall of the bag, removes the clouded lens through that opening, and places the new artificial lens inside the bag. The back wall of the bag is deliberately left intact. It is what holds the new lens in position and keeps the inside of your eye stable. That back wall, the posterior capsule, is what becomes cloudy. The bag stays. The lens stays. But the back wall of the bag, the thin, clear membrane just behind your artificial lens, slowly loses its transparency. Light passing through it scatters instead of focusing cleanly on your retina. The result is exactly what you are experiencing. Gradual fogginess, halos around lights, reduced contrast, and the feeling that the cataract has come back even though it has not. Now, the mechanism. Why does the back wall of the bag go cloudy in the first place? During the original surgery, your surgeon removes most of the lens material, but a small number of cells called lens epithelial cells remain attached to the inside of the capsular bag. These are normal cells. They are not abnormal, not dangerous, not the result of any complication. They are the cells that originally built your natural lens, and they are biologically programmed to do one thing: grow. In the months and years after surgery, those remaining cells slowly migrate from the edges of the bag toward the center of the back wall. As they move, they multiply and they begin laying down their own protein. That protein is not perfectly transparent the way the original capsule was. It scatters light. It accumulates over 6 months to 5 years depending on the patient. It accumulates enough to start affecting vision. This is not something you caused. It is not because you did or did not do anything in the months after surgery. It is not because you used eye drops too much or not enough. It is not because of how you slept. It is the normal biology of the lens epithelial cells doing what they are programmed to do, in a place where the surgeon could not safely remove every last one of them. Now, here are the 4 assumptions almost every patient walks in with. Each one is wrong. Assumption 1. The cataract has come back. No. The cataract was removed. Anatomically, it cannot return. What has clouded is a different structure entirely. The back wall of the capsular bag, not a lens. Assumption 2. I need another full cataract surgery. No. The fix is not a surgery. There is no incision, no recovery time, no anesthesia. It is a laser procedure done while you sit in a chair. It takes about 5 minutes, and you walk out the same day, with the vision change usually visible within hours. Assumption free. If I wait, it will go away on its own. It will not. Posterior capsule opacification is a one-way process. The cells keep migrating. The protein keeps accumulating. The vision keeps gradually fogging. Waiting does not reverse it. It just lets the fog get worse. Assumption 4. Once I have the laser, it might happen again. This one is the most reassuring to correct. Once the laser opens a small clear window through the cloudy back wall of the bag, that window stays open. The cells cannot reclose it. The fix is permanent. You are done with this problem for life. Now, I want you to pause for a moment and do an actual self-test. This will tell you whether posterior capsule opacification is the dominant problem in your current vision or whether something else is also going on. You will need an object across the room with high contrast. A black textbook title at about 10 feet works well. Stand in normal indoor light. Cover one eye with your hand. Look at the title and rate the sharpness from 1 to 10. Then switch hands and cover the other eye. Rate the same title again. If the eye that had the surgery is now rating 2 points or more, lower than the other eye, and that difference was not there in the months right after surgery, you have a strong PCO signal. If both eyes rate equally low, the problem may be PCO in both eyes, or it may be something other than PCO. Either way, the next step is the same. Call your ophthalmologist's office and ask specifically to be evaluated for posterior capsule opacification. Use that exact phrase, posterior capsule opacification, or PCO. Saying the name in the phone call moves the conversation past the brochure language and tells the ruler that you know what you are asking about. Now, the procedure itself is called YAG laser capsulotomy. YAG. 3 letters spoken individually. The Y stands for tritium, the A for aluminium, the G for garnet. Those are the crystals in the laser. You do not need to remember any of that. You need to know that this laser has been the standard PCO treatment for nearly 40 years. Here is the procedure from start to finish. You arrive at the ophthalmologist's office. They put dilation drops in the affected eye, sometimes also a numbing drop. You wait about 30 minutes for the pupil to dilate fully. You then sit at the laser, which looks similar to the slit lamp microscope you have already seen at every eye exam. You rest your chin on the chin rest. The doctor places a small contact lens on your eye to keep it open and focused. There is no pain, just a sensation of pressure. The doctor then fires the laser through the cloudy back wall of the capsular bag, making a small, clear circular opening directly behind your artificial lens. The opening is just large enough to let light pass cleanly through. The bag stays in place. The artificial lens stays in place. Only the cloudy portion of the back wall is opened. Total time at the laser is usually 3 to 5 minutes. Total time in the office, including check-in, dilation, and a brief post-procedure pressure check, is about 90 minutes. You walk out the same day. You can drive home if your eye is not too dilated. Most patients see meaningful clarity within hours and full clarity within a day or two. There is no incision, no stitches, no bandage. You can shower, exercise, read, and drive normally the day after. The eye drops you may be prescribed are a short course of anti-inflammatory drops for about a week. Now, the rare risk most patients are not told about. After YAG laser capsulotomy, there is a small temporary spike in intraocular pressure in some patients. That is why your ophthalmologist will check your eye pressure about an hour after the procedure before letting you leave. If the pressure has risen, they will give you a pressure-lowering drop. This is routine and resolves within hours. The more serious rare risk is retinal detachment. Cataract surgery itself slightly raises lifetime retinal detachment risk, and YAG laser capsulotomy adds a small additional increment to that risk. The absolute risk is still low, somewhere between 0.5% and 2%, depending on the patient's baseline factors. The risk is higher if you are extremely nearsighted, if you have had retinal detachment in the other eye, or if you have a family history of retinal detachment. Mention them to your ophthalmologist before scheduling the YAG. There is one situation specifically where I would tell a patient to wait. If you have active macular swelling or active inflammation in the eye, those need to be treated first, because the YA can temporarily worsen them. Let me tell you about Margaret. Composite patient, illustrative, but the pattern matches what we see routine, the imposed cataract follow-up. Margaret is 71. She had cataract surgery on her right eye at 69, and on her left eye 6 weeks later. For about 18 months, her vision was the best it had been since her 30s. She put away her reading glasses for everything except small fine print. She drove at night without thinking about it. She told her family that the surgery had been the best decision she had made in her 60s. About 22 months after her right eye surgery, she began noticing that the right eye was slowly fogging. Reading the bedside clock at night had become harder. The streetlight outside her window had developed a soft halo. She covered her left eye and looked at her television. The picture was clearly less sharp than what her left eye saw. Her first thought, like every patient at this point, was that the cataract had returned. She called the surgeon's office expecting bad news. When she came in, the diagnosis took less than 2 minutes at the slit lamp. Clear posterior capsule opacification in the right eye, early signs in the left. The surgeon scheduled the YAG laser for both eyes over 2 appointments, 1 week apart. Each procedure took under 5 minutes at the laser. Margaret drove herself home from the second one. Within 48 hours of the first laser, the right eye fog was gone. Within 10 days, both eyes were sharper than they had been in a year. Margaret had been carrying that fog and the quiet fear that her surgery had failed for about 6 months before she made the appointment. The whole problem was resolved in 2 visits. 3 habits that delay PCO diagnosis even after symptoms have clearly started. The first is assuming the fog is part of normal aging. It is not. Cataract surgery should hold your post-op vision quality for many years. If your vision quality is meaningfully declining at 1 to 4 years post-op, the most common explanation is PCO, and the fix is the YAG laser. The second is waiting for the next routine annual eye exam. PCO does not need to wait for an annual exam. Call your ophthalmologist's office, describe the symptoms specifically, and ask for an evaluation for a posterior capsule opacification. They will fit you in within a few weeks at most. The third is going to an optometrist for a new glasses prescription. New glasses will not fix PCO because the problem is not the focus. It is the scatter of light passing through the cloudy capsule. A new prescription will give you sharper words on the eye chart for about a week. Then the underlying fog will continue to worsen. Here is the action protocol. Start it today. Step 1. Do the covered eye self-test I described above. Step 1. Do the covered eye self-test I described above. Who did your surgery? Or the ophthalmologist currently managing your eye care. Use the exact phrase, I would like to be evaluated for posterior capsule opacification. Step 3. At the appointment, ask 3 questions. Is the diagnosis PCO? Am I a candidate for YA laser capsulotomy? Are there any reasons specific to my eyes? High myopia, prior retinal issues, active macular swelling that I should know about before scheduling. Step 4. If the tag is appropriate, schedule it. The procedure itself is brief. Recovery is essentially nothing. The vision change is usually noticeable within hours and complete within days. Step 5. After the tag, return to your normal routine. There are no long-term restrictions. The fix is permanent. If you have been quietly suffering with post-cataract fog for months, This is the resolution. It is simple.
It exists.
It is in the office.
It is simple.
And
It
almost
is in the
nobody
office.
talks about it.
And almost nobody
Before you
talks
go,
about it.
I want to know
Before you
two
go,
things. I want to know two things. First, how many months or years out from cataract surgery are you? Just the number. The timeline pattern across this audience will shape what I cover next. Second, has anyone in your ophthalmologist's office ever mentioned posterior capsule opacification to you before or after your surgery? Yes or no? I want to see how widespread the warning gap actually is. To recap, in case you came in late, the fog that returns 1 to 5 years after cataract surgery is not the cataract coming back. It is the posterior capsule opacification cloudiness of the back wall of the capsular bag. It affects 30 to 50%. The fix is YAG laser capsulotomy. 5 minutes at the laser, 90 minutes total in office. No incision, no recovery, permanent result. The one situation to wait is if you have active macular swelling or inflammation that needs treatment first. Use the exact phrase posterior capsule opacification when you call. It moves the conversation past the brochure language. Make the call this week. And if you know someone whose vision has been quietly fogging months or years after their cataract surgery, send them this video. They have almost certainly been carrying the same fear Margaret carried, and they have no idea the fix is one laser appointment away. I'm Dr. Richard. Subscribe for new videos every single day.